Hey there, Dr. Devon Coughlin here, and want to go over some research with you here. Recent article that was published in the BBC News. It said, stop prescribing precious antibiotics for sore throats. They're telling the GPs or general practitioners, your primary doctors. When you look at this here, the National Institute of Health said most sore throats were caused by viral infections, not by bacterial infections. And it says, but the research suggests antibiotics are prescribed in 60% of sore throat cases. So understand, everyone, the minute they get a sore throat, they think, do I have strep throat? Is this strep throat? So on and so forth. Guys, we really want to keep antibiotics as a last resort. And the research is overwhelming in sharing with us that the overuse of antibiotics is making infections harder to treat because now we're creating these drug-resistant strains of bacteria, meaning the bacteria is getting stronger and the antibiotics no longer work on them. This report says patients need rest, not antibiotics. And it actually goes on to say in here that in addition to people taking too many, you're always looking for that magic bullet. It says that really for a sore throat, evidence shows that antibiotics make little difference to the length or severity of the illness. So again, especially if you're going to your doctor and there's no culture being done, there's no test to see that there's strep present, you really need to avoid doing the antibiotics because, again, it's just going to make you more prone to having problems down the road. Remember, the side effect of antibiotics is that they're going to wipe out the good beneficial bacteria in your small intestine, which makes up a large portion of your immune system. So you want to make sure that you keep that good bacteria intact, and antibiotics are going to wipe that out. You really want to save antibiotics for that severe illness or that severe bacterial infection, like Lyme disease or something like that, so that it actually works in your body and it's not just being resistant to that severe infection. In some cases now, reports coming out of England are showing that people are dying from these bacterial infections because antibiotics aren't even working on them. All right, and so this is a big problem now with this overprescription. Again, as patients or as people, we need to take our health into our own hands, and you need to resist that antibiotic, even if you know, hey, I'm going to be in for a few days, this is going to be bad. You need rest, you need supplements, you need to eat well, you need to make sure that you're creating a stronger immune system. Don't rely on those antibiotics all the time. You need to save that for the crisis situation that you actually really need them. All right, so it's been Dr. Devon Coughlin sharing with you some of the most current events coming out of the BBC, and stay tuned for more health tips.